and devised this plan. Give him a round of applause.
Governor, you remembered that day last summer almost with picture-perfect photographic memory, and you gave most of the medical details that I was going to give, sir. So, as the governor and Mr. Fisher stated, in Ohio, we're privileged to have some of the largest, most advanced, and most sophisticated children's hospitals in the United States. And one measure that supports this fact, as has been pointed out, is we have more dollars from the National Institutes of Health to fund our children's hospitals than any other state in the United States, which is really an amazing distinction, and a distinction that the governor knows. So last summer when the governor visited Nationwide Children's Hospital, he quizzed me on what sorts of research partnerships existed amongst our children's hospitals, and I responded there are a few grassroots efforts, but nothing really organized, and I could sense that the governor wasn't especially happy with that answer. And what came of our discussions was not only a generous, but I think a visionary and insightful investment of $2 million in networking our children's hospitals in the name of research. And the first time that that's ever been done or envisioned. So what resulted from that is a couple of months later, hospital and research leaders from Akron, Toledo, Dayton, Columbus, Cincinnati, and Cleveland got together, research leaders, including Dr. Arnie Strauss, who's in the audience today, to determine how best the state's money might be invested. And to my knowledge, that's the first time ever in the history of our state that hospital leaders and research leaders gathered together to focus specifically on research. We focused on quality and done a great job about that, and focused on other issues, but never on research. We had a brainstorming session to envision what this investment would look like 5 years from now if we really knocked it out of the park. And we said, well, it has to be sustainable. So we live beyond this initial investment. We can leverage it in such a way that we can get external dollars from the state, National Institutes of Health dollars, maybe pharmaceutical dollars to bring to Ohio to continue to support the effort. We wanted to be inclusive, to involve all the children's hospitals in the state. And we wanted to have some infrastructural element to it, perhaps relating to internet-based data collection mechanism, electronic health record mechanism to gather data in such a way that we could use the same approaches to address other research projects as the years go by. So as you know now, we selected two topics, asthma and neonatal abstinence. And we considered others, but asthma really came to the forefront because it's such a common condition, as has been pointed out. There are people in this room with asthma. There are children in this room with asthma, and it's very common. It's almost cliche to note a child at a sporting event doing an inhaler because they're having trouble to breathe. But there's another side of that story, and that is asthma can be severe. It can land a child in the hospital. It is one of the most common reasons for hospitalization of children in our state and elsewhere, and sometimes they're in the intensive care unit, and about 200 times a year a child dies because of severe asthma attack. What differentiates these mild cases, the kids at the sporting event are having trouble wheezing, as opposed to these children who land in the intensive care unit, we don't really know, but there must be some genetic factors, some social factors, environmental factors that predict this severe disease. And the work that's been put together under the leadership of Dr. Neeru Hershey at Cincinnati Children's, who's a national expert in asthma research, is designed to help us figure out the fundamental difference between the responders, those that have mild disease, and the non-responders, those that have severe disease. And as a result of the collaborative, we'll be able to answer that question more quickly, more expeditiously over a geographically diverse area, in such a way that we can really hone in on these differences. And that's important because if it looks like it's going to be severe disease, then treatment should be appropriately aggressive. If it looks like it's going to be mild disease, the treatment can be simpler and less expensive. Neonatal abstinence syndrome occurs when a baby in the womb is exposed to narcotics and other drugs of abuse by the mother. And the tragedy there is that birth becomes a cruel act of cold turkey withdrawal from this in utero exposure. And it's a relatively new problem. 20 years ago when I was training, it was virtually unheard of. Now it's common. By virtue of the collaborative, we already know that there are about 600 such addicted newborn infants born in our state as recently as 2011. It's not a problem unique to Ohio. It's an epidemic across our entire country. We know that these babies stay in the hospital longer. They consume a lot more health care cost, and then they go home with their families or their caregivers, and they consume a lot of the health care dollar, and we don't really know what happens in the long run. So the best treatment approaches for the mother and the child is a goal of this neonatal abstinence syndrome collaborative, which will be led by Dr. Michelle Walsh, who's a neonatologist at Rainbow Babies in Cleveland and a national authority on this particular topic. So in sum, this research collaborative, the network that's been jump-started with this $2 million gift, will permit us to engage multiple national experts, the best minds in the country who just happen to be here in our children's hospitals in Ohio. I'm not aware of any other state focusing their children's hospital assets like this. And because of this Ohio Children's Hospital Network, we're going to fast-pace our discoveries and fast-pace answers to these problems and create an infrastructure that allow us to do this iteratively over the years. So Governor, thank you so much for having the confidence in our organizations to make this work. Now it's my privilege to introduce a family, Mrs. Gator, come to the podium, who's going to speak on asthma, a topic that she knows a lot about because she lives with it